My clinical practice intervention is about obesity and reducing sugar-sweetened beverages to reduce the risk of childhood overweight and obesity. It is well known that obesity is a growing global epidemic and has started to affect children. We know that obese children are more likely to become obese adults, so by combating obesity in children, we can hopefully decrease their chances of becoming obese adults. Sugar-sweetened beverages, such as soft drink, cordial, and fruit juices, have been implicated as part of the cause of obesity, as they are additional, empty calories that do not affect hunger. This causes an increase in the child's total kilojoule intake and alters their energy balance towards obesity. It's unlikely that the key to solving obesity lies solely in sugar-sweetened beverages. However, they may play a role in decreasing the incidence of obesity worldwide by decreasing energy intake. It would prove to be a simple and cost-saving way for children to lose weight. I searched PubMed and Medline to find some papers on this intervention using keywords such as sugar-sweetened beverages, children, obesity, and overweight. Many of the systematic reviews and meta-analyses do not just review random controlled trials, as there are few completed trials that fit the intervention question. So they also tend to include cohort studies, which are much more abundant in this area. For this reason, I've rated the systematic review at an evidence level 2 rather than an evidence level 1. Also included are 2 random controlled trials, only one of which was a double-blind trial, and both of these were also at evidence level 2. The quality of the evidence was mixed among the studies. The double-blind randomized control trial had the highest quality of evidence based on the study procedure. Inconsistencies in the various results across all the randomized controlled trials brings into question the overall quality, despite the studies appearing to be of good quality. All studies have some degree of limitation and bias, which affects the quality of the data obtained. Nutrition studies often have inherent limitations as they often rely on self-reported dietary intakes and amount of food consumed, which are chronically misreported. There is also poor compliance with study interventions, which increases with the length of the study. Some of the studies did not take a snapshot of the child's diet, only looking at consumption of sugar-sweetened beverages. This makes it quite difficult to attribute the findings only to the beverage intake, if it cannot be shown that other diet aspects did not also affect the BMI or weight changes. The 5 randomized controlled trials involved in the systematic review meant that the power to detect changes in weight was low in this review. Heterogeneity is used to indicate that all the studies in a meta-analysis have not all undertaken to the same experimental protocols or intervention type, such as a nutritional education versus beverage replacement. This makes it really difficult to draw a meaningful conclusion from these different data. The inability of some studies to create a blinded study environment does bring in a major concern of bias. There is the potential for study personnel to give unconscious cues, and subjects may be pressured by what they think the study expects their results to be. This creates bias by subjects consciously or subconsciously changing their dietary intake to be more in line with what is expected of them. There were different results among the articles on how sugar-sweetened beverages affected weight and BMI. The cohort studies within the systematic review found that a high consumption of sugar-sweetened beverages resulted in a significant increased risk of being overweight. However, the randomized control trials in the systematic review found no significant effect of reducing sugar-sweetened beverages and a change in BMI. The double-blind randomized controlled trial did find a significant reduction in weight and fat mass gained, when sugar-sweetened beverages were replaced with non-caloric beverages. The other randomized controlled trial only found a significant effect at 1 year, not at the primary outcome of 2 years. If you were to collate the findings of these 3 articles, a common thread can be pulled from their results. It is possible that consumption of sugar-sweetened beverages will increase the risk of weight gain. But replacing sugar-sweetened beverages with non-caloric beverages does not cause a significant decrease in BMI. A possible mechanism to explain this could be due to the knowledge of consuming artificially sweetened beverages, causing consumers to think they can consume more of other foods, which results in an increased net calorie intake. The take-home message from these 3 journal articles is that cohort studies found that high intake of sugar-sweetened beverages caused an increase in BMI, whilst the random controlled trials had results of varying significance. Further research is required to determine the significance of the association between sugar-sweetened beverages and weight, since similar study interventions had conflicting results. It's important to discern whether it is a causal effect. So, for example, whether sugar-sweetened beverages are a cause of increased BMI or weight, or whether obese children happen to drink more sugar-sweetened beverages than non-obese children. Thank you.